We're pumping up the adrenaline in this episode of Pathways, hearing firsthand what it's like being in the room where critical moments unfold.
We know what the doctor needs before they even do, because it's our job to be ready, especially, when it is an emergent situation, you need to be ready. It can be a lot of pressure, but if you're trained well and, you kind of gain this confidence, it's pretty incredible.
Interventional, radiologic, and cardiovascular technologists are side by side with physicians, helping make life-saving decisions in real time.
Welcome back to another episode of Pathways, part of Northern Light Health's Healthy, Happy, and Wise podcast series. I'm your host, Emily Tadlock, and today I've made my way down to Portland, Maine to visit Northern Light Mercy Hospital. Continuing with this season's theme, we are exploring career pathways that require 2 years or less of school or certification to get your foot into healthcare. I'm sitting here with Emily Bard and Catherine Cavallaro, both of whom are cardiovascular interventional techs, or CVIR techs for short.
Yes, correct.
Awesome. Thanks for joining me, ladies.
Thank you for having us.
Okay, so it's a mouthful, cardiovascular interventional technologists.
Yes.
Tell me exactly what that is. What do you guys do? Catherine, you want to take this one?
Yeah. I think basically anything that is done invasively through a very small hole, be it in the artery in the groin or in the arm, and you're going in and you're repairing, this is the cardiovascular piece, You're repairing vessels or imaging vessels in the heart or in the legs. And the interventional radiology piece, they're two separate things to us.
Okay.
The cardiovascular is one thing, the interventional radiology is another.
Okay.
So the cardiovascular is like the cath lab is what people will recognize that by.
Okay.
Looking at the heart. The interventional radiology could be anything from biopsies, PICC line placements, port placements, drain placements.
Okay.
Anything like that. So they're sort of like two different fields, if you will, kind of merged into one.
Okay. All right. So tell me, how in the world did you get into this specifically? Emily, you want to start?
Sure. Yeah. So this is a second level of schooling for me. So I went to school for business out of high school, and then I said, I don't think I really want to do anything for business. So I heard that this was a 2-year program, and I was like, that sounds like an interesting, cool job. I think I broke my arm when I was in 4th grade. And I said, wow, that's pretty cool. So I was like, let's go to school for that. So here we are. Went to school for that for 2 years in Bangor, actually.
Okay.
And the neat part about X-ray and having this degree is that you can cross-train into other modalities. So I actually started as an X-ray tech and CT. I did CT for a while.
Okay.
And then there was a job opening down here in Portland, and I said, I want that. I had no experience in it. They took me in. They trained me on the job. It took me about a year to train at Maine Med. That's where I trained originally for this, in the cath lab there.
Okay.
So, and I absolutely fell in love with that. So, and then came over here, and it's been great.
Okay. What about you, Catherine?
Well, I had a different approach. When I was in high school, my mother was a nurse with Mercy for 44 years.
Oh, wow.
And it was sort of almost not expected, but people just assumed that that's what I was going to do.
Oh, okay.
My senior year, I put the brakes on. I said, no, actually, that is not what I want to do. But I knew I was going to do something at the hospital. So there was a gentleman named Bruce Graham. I'll never forget his name. He gave us these tests in high school, the ASVAB test.
Oh, yeah.
And it was explained to me, and it was a military thing, but it was explained to me that it will help decide what your interests are. It said I would be good at 2 things, X-ray and jet engine repair.
Okay. All right.
Honest, true story. And I really didn't know much about X-ray, Unlike Emily, she hadn't had an experience with a broken arm. I had no idea. So I went in and I shadowed her, and I'm like, yes, exactly. And here I am, 37, 38 years later.
Wow.
Yeah. So
just a test, and then,
and here
you know
I am.
what? Yeah.
Yeah,
I think
it was
I'll do
spot
that.
on because I love it.
Oh, that's awesome.
Mm-hmm.
So 37, 38 years
Yep.
roughly.
Yep.
Talk a little bit about how the field has changed.
Oh my gosh, it has changed so much. And that is exactly why I love it, because it's ever evolving. Gosh, when I first started, we had dark rooms and film and certain procedures that we really didn't do because there wasn't the technology. And then I remember when the first arterial stent came out, and you had to hand crimp them onto the balloon before you placed them. And now everything is pre-mounted. It's on a catheter, on a balloon. Just everything is just in the short, even 20 years has changed so much. But that's the great thing about radiology in any modality is it's constantly changing and constantly, evolving to, I don't know, faster maybe or easier for the caregiver, for the doctor, I think.
And even for the patients.
Yeah,
absolutely.
Yeah, to be able to go in and take care of these things through a little hole in the artery and let them go home that day. I mean,
it seems crazy that that's even possible.
Right.
That's awesome. So, we talked a little bit about how you decided to get into this career. Let's talk a little bit about the education piece. So you both went to school for X-ray, correct?
Yes.
And then you mentioned cross-training. So actually, we just had an episode air a couple of months back with a CT tech at Northern Light AR Gould's Hospital, and they talked extensively about being able to cross-train. She went to X-ray school, and now she does CT, and she loves it. So is this the same sort of thing? This is one of those modalities that you can train into?
Correct.
Yep.
Yes.
Okay.
There are schools that you can go to.
Okay.
I think the closest one is it Virginia?
Virginia. Yep.
Virginia.
Wow.
But, and there have been some techs who've worked with us that have gone to Virginia, but the majority of them, I think, has just been on the job training.
Wow.
Yep.
This seems so specialized. Like it's absolutely something I'd never heard of before. I mean, you both walked in and I was like, I can't wait for you to explain to me what this
What
is
it is.
because I've never heard of it. But cath lab I've heard of before.
Right.
And fortunately, I've never had to have one of these procedures. So maybe for those people like me who are fortunate like that, explain a little bit what these types of procedures are like and what you do specifically as a technologist.
Okay.
I can hit on the cath lab piece, and how about Kathy hits on the IR piece?
That would be great.
Yeah. So in the cath lab, it's a sterile procedure. So you're going in through an artery. We do also vascular in the vein as well. But so you're getting access to a radial or a femoral artery. So that requires numbing medicine. You go in with a needle and you get access to the artery. Through the artery, we go in with what we call wires and stents or balloons. We actually don't do that here at Mercy. We did that at Main Med up the hill here. But basically what you're doing is you're opening up an artery that was closed. So when you hear the term heart attack, that's what we're doing. We're fixing a heart attack. So you got 3 main arteries that feed the walls of your heart. So your heart is a muscle, just like any other muscle in your body. It needs blood flow to it.
Okay.
So when somebody's having a heart attack, what's happening is one of those arteries or multiple of those arteries are being blocked, whether that be plaque or, from bad diet, tobacco use, genetics, whatever it may be. We're going in with a small wire, putting it down into that artery using X-ray and X-ray dye. So we're seeing it up on a screen.
Okay.
And we take different, images to see exactly what we're dealing with. Go down with a very tiny wire through that artery. So we start in the wrist, goes all the way to the heart. And then over that wire, we use it as almost like a railway. And we put down balloons. And we blow up a balloon so it expands that artery. And then we put a stent. So a stent you might have heard of before.
Yeah.
So that'll go in and we expand that again with another balloon. And then the stent stays and everything comes out so that it opens up that artery again. And there you go. And you have your blood supply to your heart again.
And you're doing that.
So we are standing along a cardiologist for those
Okay,
procedures. But it's pretty interesting because that's kind of my favorite part is that we know what the doctor needs before they even do. Because it's our job to be ready, especially, when it is an emergent situation, you need to be ready and know what they need before they even need it.
Wow.
So
Anticipate.
it can be a lot of pressure. But if you're trained well and, you kind of gain this confidence, it's pretty incredible when it comes down to it.
Oh, that's awesome.
Yeah.
Okay. So Kathy, why don't you explain the other side of things?
The interventional piece, interventional radiology, again, it covers a lot of different procedures. If a patient has been diagnosed with cancer and they need chemotherapy, because some of the drugs are very caustic to the vessels, they put Mediports in.
Okay.
And so we assist with the Mediport insertions. If a patient has, a funny bump somewhere in their neck or anywhere and they need a biopsy, we're the ones who do that. If the nurses on the floor can't get an IV in a patient and they need a PICC line, we are called to do that.
Okay.
So, it's just a whole,
there's a whole gambit of
it's
things.
a whole
that you
gamut
guys
of
do.
things. It really is. It just depends on, and you jump from one thing to the other. In the morning you may be doing a liver biopsy. You may be draining fluid out of somebody's abdomen. It's called a paracentesis. And then you go from there to perhaps there's a woman who has been experiencing infertility. And so we do a procedure where we actually inject contrast into the fallopian tubes to see if they're even open. So there's so many different things that we do.
Oh my goodness.
And you can have a kind of an emotional day at the end of it all. It's a lot. You go, but it's very rewarding. As Emily said, you in most cases, you have the results, boom, right there. You're a success. You did it.
Wow.
So
you guys are also working alongside very closely with physicians, providers, nurses, to provide this type of care that's needed. And it's so specialized. Like I had never even heard of the infertility piece. Wow. And you're doing so many different things. No day is, I would assume no day is similar.
Correct.
No, and things get added on all the time. So there's constantly things coming in, requests being made, phone calls to the doctor, and a lot of times our radiologists will come and say, hey, we got to do this, we need to do that. And it all depends on, what's in house or what's coming through the door, what's in the emergency room.
Oh, wow.
Yeah.
Well, what do you guys love most about your job? Emily, we'll start with you.
I just, like I said before, like it's incredible when you're a part of something where you actually, like what Kathy just said, somebody comes in having a heart attack or a problem and you can fix it right there. So just going home knowing that you've made a difference and helped somebody that day, it's an immediate kind of gratification with that. So
It's very satisfying.
Yeah.
I would say the same thing. It's very satisfying. You really put in a great day's work because you feel good about most of the outcomes that you experience. The other thing I would say is the ever-evolving technology. But I think for me, the number one piece is relationships with your coworkers, because you are very tight. You're very tight with the nursing staff because in each case you have the doctor, you have a nurse, and you have a tech, at least one tech. And you all have to work so closely together, and you have to read and feed often to each other what's going on. And as Emily had alluded to earlier, anticipating what that doctor is going to need and trying to have that ready. Because in some cases, time is
Of the essence.
Right. It really is. So I think the relationships that I've made over the years and just my coworkers is probably why I love it the most.
Okay. So teamwork is imperative to this profession.
Yeah, absolutely.
Okay. Interesting. So yeah, because, a lot of our listeners, either we're hoping just to enlighten them into what some of these career pathways look like, or maybe even encourage them to look at this as a potential career path. So what would you say to encourage someone to think about this? And I would also, maybe ask you, this all like, as I'm talking to you, I'm like, oh my gosh, how hard must this be? Like, how difficult is the training? How difficult, oh my goodness, you have to know how to do so many different things. It seems almost intimidating. What would you say to that, or to someone who's maybe feeling the same?
I would say, it's one day at a time. It does take time to learn. It's and it can be overstimulating and overwhelming at first. But it, like I said, it's so rewarding when you're finally at that point where you can read what the doctor needs before they ask for it. Like, that's when you're like, okay, I know what I'm doing. And it took me about a year to be comfortable in the cath lab. In IR, I'd say at least a few months, and that's after I had already had some experience in the cath lab. So it does take time, but it's so rewarding. It's worth putting in that effort and time.
And I think everybody makes an investment too. Like if we have a new tech come on board, it's only going to benefit us to get that person up and running because we need the body.
Yeah.
You know, I mean, it's not always saying who's going to do what procedure. It's like, okay, you guys, I'm going to go run and do this, in CAT scan, and I'll after that I'll go do this, and somebody's going to go to the SKU and put a pick in, and and you just are throwing things at each other and then just going. And I think that if we take the time to train somebody, and if they really like it, it's a wonderful investment because we need good people on the team.
It's a common theme on a lot of these podcast episodes that we need people. Recruitment in healthcare is very essential right now, pretty much in any sector that you're looking at in healthcare, whatever it may be. So it's not really surprising that you're saying that you need the people. But maybe what's some of the barriers you think to getting into X-ray as a career?
I would say a barrier for me was I wanted to be in healthcare, but I have a hard time with bodily fluids, let's say.
Okay.
I don't, however, have a hard time with blood, so that hasn't been a hard thing for me.
Okay.
But that would be my one thing with healthcare in general. It's like I don't think I could ever be a nurse because I can't do some of the things that they do. I don't have the stomach for it.
Right.
So as long as you can handle blood and then you'll be fine. Okay. But blood is the biggest thing, I guess. I know. It's kind of, I don't know how else to say that without,
I think we hear that a lot from different people that say, we had a CNA on, and they are someone who does have to deal with a lot of bodily fluids. And they're saying, I couldn't do any other thing, like taking care of this person and their direct needs, making sure that they're comfortable after a procedure that you guys may have done, who knows?
Yeah.
It's so interesting to hear each person say, I couldn't do what they do. I couldn't do what they do, but I love what I do.
Right.
So I think maybe it's finding your niche, finding exactly what it is that you want to do.
Absolutely.
And there's so many facets in healthcare.
Absolutely. Yes.
I think there's something for everyone, just kind of depending on what it is you think you can handle.
Yeah.
Hi, I can't handle any of what any of you guys do, but I can talk in a microphone.
Yeah, there you
and
go.
I can talk to you guys about what you love to do. So we all find something that we can do in healthcare. So any parting words, any final words that you'd like to leave with our listeners about your job or what you do, or encouraging others to pursue this career?
I think X-ray is a great route to go in if you you think you want to be in healthcare. Again, if the bodily fluids thing isn't huge for you, it's a good starting point, and you can train into different modalities, whether it be CT, MRI, ultrasound, what we do in the IR cath lab. So definitely a lot of options, and I do recommend it to people that are kind of like on the fence, like just do it. There's so many things you can do with it.
Yeah.
So
I when I went to school, we were trained by the Sisters of Mercy. It was a long time ago. And, and as Emily said, you can go into so many different modalities because not only do I do the IR piece, but I also do a day in mammography. So it's very, very common for rad techs to cross train into other modalities. And I think it's more of a supportive role, CAT scan needs help, and there are some techs that maybe are diagnostic techs that can cover in CAT scan, or eventually going to CAT scan and maybe fill in a full-time position. I think it's very, very common for X-ray techs to wear many, many hats.
Yeah. And I think one of the important things to point out is, patients, a lot of times imaging is their first stop. So when you say, it's typical for us to cover here or to cover there, it's because there are so many patients, and many of them, their first stop is imaging. So there is a need for lots of imaging specialists.
Right. How else would the doctor know where to send the patient next?
Right.
It is the first place that they're going to discover exactly or potentially what's going on and have a better idea of where to send that patient from there. So whether it is a CAT scan or whether it is an ultrasound or whether it is a diagnostic x-ray, that's going to be the first stop for a lot of patients who come in.
Awesome.
It's the tell-all usually.
The tell-all. I like it.
Sure. We can see right through you.
Oh, that's really, I like how you put that in. Nice one. Awesome. Well, ladies, thank you so much for being on with me today and explaining exactly what you do. I really appreciate it.
Okay.
Thank
Thanks
you.
for having us.
Thank you for listening to this episode of Pathways. Please join us next time for a new episode. There are several ways you can tune in on our website at northernlighthealth.org/healthyhappywise. We are also on Apple, YouTube, and Spotify, which makes it easy for you to listen on the go on your favorite app.